is the most likely cause of this patient's hyperthyroidism? Okay, hyperthyroidism. I know Hashimoto's is already hypothyroidism, so I would get rid of that immediately. Anyway, and then I can just go. A 55-year-old man with a history of long-standing multinodular goiter is started on iodine supplementation by his primary care physician. 6 weeks later, he presents to the clinic with sweating, heat intolerance, and unintentional weight loss. On physical examination, there's an enlarged thyroid gland, and the patient has a mild tremor. Laboratory tests reveal elevated T3 and suppressed TSH. Okay, I would go ahead and get rid of subacute thyroiditis. They would say it hurts.
Okay.
And so no. Um, Iodine-induced hyperthyroidism, Graves' disease. Um, I I'm just not. I don't know. Maybe I should be getting. I'm not getting Graves' disease from this.
Okay.
Um, the fact that they just gave him a iodine supplementation, however long ago, and then 6 weeks later, which I imagine it would take a while for actual symptoms to occur. I would go ahead and say iodine-induced hyperthyroidism.
Okay.
And plus a thyroid adenoma, I mean, that implies that there's just one. And it's a
Okay.
multinodular goiter, so no. And then I just don't get Graves' disease. Not a very good answer, but yeah, I'll go with C.
Yeah. Cause and effect, right? I mean, just work through the problem, right? They're not going to tell you that they give iodine supplementation and then, give you, oh yeah, all these things happened after it unless it played a role. You know what I mean? So
Exactly.
they're not
Yeah.
going to give you, random piece of information if they don't want you to use it. So yeah, even though I think a lot of people would put Graves here just because there's hyperthyroidism, right? But it doesn't fit with Graves, right? Because they told you that they gave him iodine supplementation. They already gave you that he has a long-standing multinodular goiter, right? So a lot of nodules, and then all of a sudden you give them iodine, and then it flares up a hyperthyroidism like storm, right? So it's from the iodine. Like you said, thyroid adenoma, I think you worked that beautifully. It's usually just one, right? But he has more than one nodule, right? It's not just one, right? That's producing this. And
Yeah.
iodine's not going to really affect that. And then Graves, you have like Graves' eye disease and things like that. Hashimoto's, the one thing I do want to mention, they don't usually ask this, but in case they do, I've seen sometimes maybe like,
Oh, you're right. It can present with a hyperthyroidism in the
yeah,
early symptom stages of it.
yeah. So remember, Hashimoto's. I mean, this gets a little bit into the weeds a little bit, but I have seen it asked, which is why I'm going to mention it. Hashimoto's has three stages. The beginning stage, you can actually be hyperthyroidism. You have euthyroid, right, where your thyroid is slowly burning out, and then obviously the one that everyone knows is the late stage, which is where you have hypothyroidism because your thyroid is completely dead, right? And the reason why you have hyperthyroidism with Hashimoto's early is because remember you have antibodies against like TPO, which makes which makes your T3 T4, but it leaks out whatever it has. Your thyroid leaks out its T3 T4 of whatever it has. It doesn't produce anymore; it just leaks it out. So initially,
Mm.
you're going to be hyperthyroidism with Hashimoto's, and then over time, as it dies, it becomes normal again. And then after a long time, then your thyroid completely dies and you become hypothyroidism. So just keep that in mind in case they ask.